Good morning, Wesley. My name is Georgia. I'm going to be your nurse today, okay?
Okay.
Is it okay if we perform a physical assessment today?
Mm-hmm.
All right, and we're going to also do an assessment of two body systems, the heart and the lungs, all right? Can you tell me your full name?
Wesley Clark,
Good, and your date of birth?
5/18/92.
All right, good. And where are you right now?
My house,
All right, and what year is it?
2016.
Okay, good. All right. I'm going to give you 4 unrelated words, and I want you to remember them. And later on in the assessment, I'm going to ask you to repeat those words to me, okay?
Okay.
The 4 words are banana, stop, hurricane, and cat.
Banana, stop, hurricane, cat.
Yep. Can you tell me what you had for breakfast this morning?
Bacon, egg, and cheese sandwich.
Okay, good. And who was the first president of the United States?
George Washington.
All right, good. So we have a 26-year-old female, alert and oriented ×4 to person, place, time, and situation. Patient has erect posture and appears pleasant and cooperative. No gross abnormalities noted. Patient's height is 5'8". Patient's weight 125 pounds with a blood pressure of 101/82, pulse ox 100%, respiratory rate 16 breaths per minute, heart rate 72%, and a temperature of 98.5. All right, Wesley, can you repeat those 4 words to me?
Stop, banana, cat, hurricane.
Okay, good. So we're going to now move on to the lung and respiratory part of the exam. Would that be okay?
Mm-hmm.
All right, I'm going to get down here with you, and I'm going to pull your shirt back a little bit to inspect the skin and the chest, okay? Let me pull this down. Looking for any lesions or masses. Skin color is appropriate for ethnicity. No mass is noted. Chest appears symmetrical. All right. So now what I'm going to do is I'm going to basically put my hands over certain parts of your chest, and I want you to repeat 99 over and over again. It's to test the vibrations to make sure there's no abnormalities, okay?
99, 99, 99, 99, 99, 99.
Good. Now I'm going to palpate. Or percuss, excuse me. All right. Now before moving to auscultation, I want you to cross your arms across your chest, and I want you to take some nice deep breaths in for me, okay? Noting expansion of the chest wall and any abnormalities. All right, one more time for me. All right, good. Now let me take a listen, okay? All right, good. I'm going to take a look at your nails. All right, nails are pink and thick. All right, and skin turgor, instant recoil. So we have a patient. Respirations are regular and unlabored. Respiratory rate of 16. Lung sounds are clear, no audible cough present, no adventitious lung sounds. Chest is symmetrical. Skin tone is appropriate for ethnicity. Skin is smooth. Hair is evenly distributed over the chest. And there's the vascularity is normal. The skin turgor represented instant recoil, and the nail beds were pink and thick. So now we're going to move over to the cardiovascular portion of this exam. Would that be okay?
Mm-hmm.
All right. So once again, I'm going to inspect your chest, okay? I'm noting any visible pulsations on your chest, okay? All right, now I'm going to ask you to lean forward while I inspect again for any visible pulsations. All right, wonderful. I'm going to get you to lay down, please, on your back, supine. Wonderful. I'm going to check again for any visible pulsations. I'm going to palpate your heart sounds, okay? Feeling for any pulsations in the chest. Now we're down here at the apex at your PMI, located at the fifth intercostal space midclavicular line. Pulse is regular and non-bounding. Now I'm going to take a listen to your heart sounds. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Good. I'm going to feel your carotid pulse up by your neck, okay? With 2 fingers on one side and now the other. Good. Now I'm going to take a listen for any bruit. Hold your breath. Good. Good. Now we're going to work our way down the body. I'm going to feel pulses on both sides bilaterally. We're going to start with your temporal, okay? Good. +2 for the temporal pulse bilaterally. Now radial pulse. Good. Good. +2 radial pulses bilaterally. Now to the femoral pulse. +2 there. +2 on right and left femoral pulses. Now down for the dorsalis pedis pulses. Good. Dorsalis pedal pulses +2 bilaterally. Now we're going to inspect the legs. Legs are smooth. Veins are present and visible in the lower extremities, however no distension is present. No edema is present, and skin color is appropriate for ethnicity. Now we're going to check capillary refills. Less than 2 seconds on the left hand, upper extremity. Less than 2 seconds on the right hand. Alright, and less than 2 seconds on the lower extremities. And now while you're laying down, I'm going to check to make sure there's no jugular vein distension, okay? And then I'm going to ask you to come up to about 30 degrees and 45 degrees, okay? So right now, there's no JVD present. Now if you can, just come up slightly. Alright, good. Still none. And all the way up to 40, okay. Good. Alright, no JVD present. We checked our pulses, we did our cap refill. Skin color is normal. And that's the end of this assessment. Thank you so much, Leslie, for being my patient.
Thank you.